Oops. Hello. Hi. Special request. Would you happen to have any dry erase markers?
Yes.
Set a timer for 30 minutes.
Okay, welcome everyone. This is our first Q&A live with Dr. Lena. I am at Sedona Community Library in Sedona, Arizona. Here in the US, I got this idea for Q&A sessions when I was in Malaysia with my good Malaysian friends. We had such a good time. They asked questions, we put them in a little box, and I would simply pull a question out. All these questions were based on health and wellness, which is my background, and I was just able to answer them right there on the spot. Now, I've got to give my disclaimer. I don't know everything. So, there are going to be some questions I won't know the answer to. That is completely okay. What we do with those questions is we write them down and then we bring them out later after we've had a chance to look them up and find a good answer for you. So if you have questions, feel free to put them in the chat. We'll be paying attention to those and we'll get to them likely at the next Q&A session. We plan to do these every Friday. So I'll write this up here. Okay, Q&A with Dr. Lena. And we will do this every Friday at 1 p.m. right here at the Community Library of Sedona, here in West Sedona, in Sedona, Arizona, in the U.S., as well as on YouTube Live. So you're welcome to join in, and I'm glad that you're here today. So I do believe these will be available for review afterwards as well. So for those who can't make it live, you're still welcome to join in whenever you have an opportunity to do so. So for today, because this is our very first one, I wanted to work out some kinks. I wanted to be able to ask some questions, to have some questions answered that I already received previously. I'll do that. Now I'm just going to lay a few ground rules. First, I got to give an introduction. So my name is Dr. Lena. My full name is Lena Gamble. I am a family medicine physician. I was trained at the University of Alabama at Birmingham, and my passion in life is medical missions. So I really enjoy going to other countries other than the U.S. Where medical care is not accessible or not available, and being that physician that people are able to see. Now, for me, that's my life goal, that's my life passion. I'm really excited about doing that. But I also felt like, why not offer some type of service while I'm here at home in the U.S., not currently on a missions trip. So here I am doing my question and answer session right here in the U.S. and very excited to do that. Now, I also have a PhD in molecular pathology, and that is my very favorite subject in the whole world. So if someone begins to ask questions about genes and how they work, how diseases work, all of those types of things, I absolutely will try not to go down a rabbit hole. So this works better when I have an audience, because someone can kind of put their hand up and let me know I should probably, back out of the rabbit hole a little bit. But if I'm going to be on video, just doing it, I may go down a rabbit hole. There's a disclaimer for that. Now, another disclaimer, I do work for a company. I think the company name is Here 3, and we do sell a line of supplements. I will not speak one word about those supplements while I'm doing this Q&A live session here at the Community Public Library in Sedona. This is a completely free session. It is an advertisement-free session. There's no pressure. I'm not even giving information about any of the supplement line that I do offer. So there's that disclaimer as well. Now, what I intend to do today, just for the next 15 or 20 minutes or so, is give information on the questions, or actually give answers for the questions that were asked in Malaysia that we didn't get a chance to get to. And so just like I said, if you like to ask your questions in the chat and we'll get to them, I meant it. So I've got some questions that we had in Malaysia that we never did get a chance to get to. And I'm going to get to those questions now, okay? So the first question, they're asking about collagen. What type of collagen is best? And these are all supplement-based questions. And so, because of the nature of the work that we're doing. So I've got my phone here. I'm gonna pull up some resources that I found that will actually help me to answer these questions best. Now this is my old phone, so this might take a second. I don't have everything set up the way I do on my new phone, which I'm using for this video. So give me a second, gotta get online. Sedona Library, Wi-Fi, thank you. Okay. And now, I hope I'll be able to edit this video later. We shall see. I am going to my resource now, finally. All right, so we want to talk about collagen. And this person is asking about collagen. We're not talking about any particular products, but collagen in general. Lots of people are wanting to take collagen. Why? Because it improves hair, skin, and nails. Right? They all get stronger, healthier with collagen. What a lot of people don't know is that collagen actually supports your bones and your joints. So every single joint in our body has cartilage, right, between the joints. The cartilage is made up of collagen. And so collagen is actually the number one protein in the body. There's more collagen in the body than any other type of protein. So it's quite abundant, right? So one of the things you want to know, well, if I'm going to take a collagen supplement, what type of collagen should I take? Well, why would you want to take a collagen supplement? Easy answer is because collagen is produced by our own bodies, but that production decreases somewhere between ages 25 and 30. You're not making as much collagen as you used to. How do we know? Because that's when you begin to have fine lines, wrinkles, sagging skin, all of those, and that type of process increases as you get older. And so you begin to see more and more of these fine lines, wrinkles at the time when you get older because you're producing less collagen. So for this reason, people have decided maybe I should take collagen. Maybe that will help me. Now, what type of collagen should you take is the question that someone has asked. So there's several types of collagen in the body. Type 1 is the most abundant. So you're going to find type 1 collagen everywhere in your body. Now, type 2 is what we know as joint support type of collagen. Again, there's different types, right, that make up your body. Type 3 and type 5, as well as type 10, are just much less common. So type 1 and type 2 make up over 90% of the collagen in your body. So if you're going to take collagen, it would make sense to take the type of collagen that will be helpful to support your own body. Now, should it be liquid collagen or powder collagen? Well, I've got some ideas that are pretty much founded in physiology. For example, just got to give you a little bit of background so you can come along with me on this physiology journey. So, collagen is a protein, right? It's a peptide. Peptides are proteins, right? It's a peptide that's made up of amino acids, okay? Now, amino acids are just the building blocks of peptides. It's kind of like letters are the building blocks of words, okay? So that's the idea behind this. Now, if you take a peptide and you put it into an acid bath, which is what I call the stomach. Stomach is an acid bath, right? What happens? It simply just breaks it down. So the acid in your stomach is stronger than the battery acid in the battery in your car, okay? Now, if anybody's ever had any experience with battery acid from a car battery, you know that, if you stick your finger in there, it literally can melt the flesh off of the bone, right? That's how strong that acid is. It breaks down everything. That's what it does. That's what acids do. The acid in your stomach is stronger than that, right? So we're talking about, we're going to take a naked peptide and we're going to dump it into an acid bath. Does anybody think that would be helpful? Okay, neither do I. So if you're going to take a collagen product, what you really want is to make sure that it is the type of product that, number one, can survive the acid bath, right? Has it been designed to actually move through the stomach and get to a place where it can be absorbed? That's the question you want to ask about your collagen product, okay? Now that information may be able to be found on whatever website you purchase your products from, that type of thing, but look it up. You want to make sure that it is, I can't think of a different word other than designed to survive. And what do I mean by that? So if you think about a little bit of pharmacology, Okay, you guys aren't gonna think about that. What if you think about the medications that are in your cabinet in your bathroom, right? So they they typically take on different forms. Some of them are liquid forms, right? Some of them are capsules. Some of them are tablets, right? This matters, right? The formulation that the medication um, takes on. Why? Because the capsule in itself or the coating around the tablet may be designed to withstand that initial acid bath. There's a reason that medications are formulated the way that they are. In the same way, there's a reason that supplements are formulated in the way that they are. Right? So you want to pay attention to, if you want to start a new collagen, how is this formulated? Is it designed to survive that initial acid bath and get this collagen where we want it in the body? Okay, so that's what I would say about should you take collagen, what type of collagen you should take. Um, those would be the things that I would suggest that you pay attention to. Again, I'm not going to endorse any one product over another. I'm going to say as you go out and do your research and you look at different products, that's the type of thing you want to pay attention to, right? Can you get that collagen to where you want it in the body um, in the formulation that it's being offered to you? So if it's a powder, if it's a liquid, how is it designed? Um, what have the formulators done to ensure that it can be absorbed so that your body can get the best use out of it? You can have beautiful hair, skin, nails, and joints. Okay? That takes care of that question. Now on to the next. What are the side effects of long-term statin drugs? Excellent question. And then there's another question, do they cause dementia and brain fog? Okay, now I've got to give a disclaimer here. Nobody's paying me to be here. I literally am getting zero money for this. So there's not any big pharma, there's not any company, there's nobody that is saying, Dr. Lena, we will pay you to say XYZ. I wouldn't mind getting paid, I'm just not. So that way I can give you my honest opinion. Take that back, I'm not giving you my opinion. What I can give you is the unadulterated data behind the answers that I'm offering, okay? So let's look this up really quickly because who keeps information about statins in their head? Not me. So what I want to know are I want to know the actual long-term effects of statin drugs. Now I can tell you lots of things about statin drugs, how they work, why they work, what they do long-term. But the question on the table is the long-term side effects. And as I'm looking that up, I do want to let you know that for every drug, the way we decide whether it's worth it to take it or not has to do with risk-benefit analysis, okay? Now, some of you might be familiar with that term, some of you may have never heard it before. That's completely okay. Now, risk-benefit analysis is what I do as a physician when you come to my office. Say, for example, a patient comes to my office with, I don't know, a minor laceration on their hand. What am I going to do? I've got all kinds of medications, all kinds of drugs at my disposal. I can write a prescription for anything I want. Very powerful, right? Now, I have to have some really good sense and some good parameters that help me decide when to give which drug, because it's not always helpful to give the most powerful drug I can give. Why? Risk, benefit. For example, again, someone comes in, they've got a cut on their hand. Am I going to use a chemotherapy drug to help that heal? No. Why not? Right? It could be a very good drug. It could help to heal that. Why wouldn't I use it? Well, because we know that in general, chemotherapy drugs have horrific side effects, right? They've got a cut on their hand. They're going to live. They'll be okay. Would I use something with horrific side effects to heal a cut on someone's hand? Absolutely not. The risk outweighs the benefits in this situation. Now, different patient comes in, they have stage 3 pancreatic cancer. Okay, I can look at the risk versus the benefit and say, I've got this same chemotherapy drug, right? It can help for sure with this type of cancer. Do I give it to that patient or not? Absolutely. Why would I do something like that? This drug has horrible side effects. We just said that this drug has horrible side effects. Why would I give it to someone? Well, in this case, the benefits outweigh the risk, right? This person with stage 3 pancreatic cancer will surely die if we do not intervene, or unless God intervenes, right? Like there has to be some kind of miracle, something, either a miracle or some medication, but something has to intervene. If they go along on the path that they're headed on, right? We know the end of that path is going to be death. You can't live without a pancreas. So I can intervene with a medicine that I know has horrendous side effects because the benefit of that outweighs the risk, right? Now, if they've got a cut on their hand, I am not giving them a medicine with horrendous side effects. Same concept, risk-benefit analysis. So when we're talking about our statins, right, we just bring this to the forefront with the question at hand. We want to see what risk-benefit analysis needs to be taken into account when we look at our statins. And one of the risks that we need to analyze is the long-term side effects, right? Which is what this question is all about. So let's see. I've got my information source pulled up here. I'm looking at side effects. I'm trying to find the long-term ones. So what I am finding, I may have to actually come back to this question despite my wonderful fun time of discussing the risk-benefit analysis, which we have to do for every drug we look at anyway. Give me 1 second, I'm gonna look at a different source. I was finding the side effects, but I wasn't finding the long-term ones. So let me look that part up. Now we do know the short-term side effects of statins, right, as a class of medications, right? So there tends to be muscle pain, some fatigue, things like that, can for sure be some of the side effects. But let's see what the long-term side effects are. Potentially liver damage. I've got tendinitis here, which is an inflammation of the tendons. There's an increased risk of type 2 diabetes, right? Potential for kidney damage, sleep disturbances. Rare side effects include risk of cataracts, increased risk of peripheral neuropathy. So these side effects all depend on which type of statin, what dosage of statin, and what length of time, okay? So what we do know, the majority of patients do not experience significant long-term side effects from statins. Now, statins have been around for decades. So what we do need to pay attention to are the, again, risk-benefit analysis. Well, we're looking at the risk here. I do see cognitive impairment on this list. I would want to do a bit more research to find out, okay, what is the level of risk, and is it actually linked to this in a causal relationship, or is it just an association? So we'll get to causal and association in just a second. Let me write that down so I don't forget. Association. Okay. So, what was I gonna say? I forgot what I was gonna say. Let's see. We're talking about statins, and yes, risk-benefit analysis of statins. So what you need to take into account is what you know are risks versus what we know are benefits. Okay? Now, I actually haven't looked this up in a while, and the fun part about these questions, I could have looked them up and come and given a really nice talk with all the ironed out answers. That's not the fun part. The fun part for me is actually just taking the questions on the fly and giving you the benefit of my decades of study in this field, right? So here we are with me going off the cuff. I haven't done a ton of study beforehand, and I'm looking things up as we go. So this is the fun part for me. I actually think I will revisit this because so many people do want an answer to this question. And so I will actually go and look this up and come back with very specific details. But what I can tell you from what I've studied, the last time I studied statins was the data was showing a significant decrease in cardiovascular mortality all over the world in like this certain time span, which was like I think 30 years at that time. So what's the number one cause of death in the world? Cardiovascular disease, heart attack, stroke, right? That's what's doing it. And there are some places in the world where it's still infectious diseases, it's still accidents, that type of thing. But in what we are calling the developed world at this point, where people have access to medical care and aren't dying from pneumonia or diarrhea, right? And you know, we have access to emergency services, so people aren't dying in a car accident on the side of the road because you just call 911, right? That kind of thing, right? So people are living longer, and in societies where people are living longer, the number one cause of death is cardiovascular disease. Okay, so since the invention of statins, right, they've actually decreased the percentage of cardiovascular disease all over the world in all of these societies where people are having longer lifespans. So that would be the benefit of taking statins, right? They literally are cardioprotective. So that's number one. So do they decrease your number one risk of dying? Yes, because your number one risk of dying is going to be cardiovascular disease. That's a generalized statement, right? Like if you have lupus or if you have some other disease, maybe you have a different number one risk of dying. But for the general population, the number one risk is going to be cardiovascular disease, right? And so statins do actually prevent cardiovascular disease deaths. In fact, the last time I studied this, statins reduced all-cause mortality. All-cause, which is very interesting. What does all-cause mortality mean? It means when they did the study, people who died from heart attack, people who died from stroke, people who died from diabetes out of control, DKA, right? People who died from various causes, it was all decreased when they were on statins. And so that puts statins in an elite class of medications. There are very few medications that decrease all-cause mortality. That's huge. That is a benefit that we need to weigh against the risk. Now, if the risk is that very few people have long-term side effects, this isn't chemo drugs, right? Where basically everybody has horrendous side effects, right? Like you've got 98, 99% of people that you put on a chemo drug are gonna have, you know, these terrible negative side effects. Well, it's not that, right? So the question is, what is it? Is it 50% of people? Is it 20% of people? Is it 10% of people? Is it 2% of people? What percentage of people are seeing long-term side effects, and what are those long-term side effects? Right, those are some of the questions that I want to bring back and answer regarding statins. Now let's talk really quickly about causal versus associative types of relationships when we're looking at data, right? So what would be a causal relationship between data points? For example, when it rains, if you go outside, you get wet, That's causal, right? The rain causes you to get wet every time, 100% of the time, right? Can you block the rain from falling on you? Absolutely, you just get an umbrella, right? But then the umbrella gets wet, right? The ground gets wet because rain happens. That's a causal relationship, okay? Rain causes things to get wet. That's how that works. Now, what's a relationship that is associative? So, things that are associated with different things. For example, one example I like to give is car accidents, right? For example, you could have someone to say, every time there's a fatal car accident, like a really bad one, where, 2 or 3 people are dead on the scene, it's horrible. Every time you have one of those, there's like glass everywhere on the ground. And so my hypothesis is that if we can keep the glass from getting all broken up in these cars when there's an accident, we can prevent fatalities. What have I done there? I've made a common error of taking something that's associated with accidents and confusing it with something that's causing the result, right? So glass being broken at a fatal car accident happens 100% of the time. Does the glass being broken cause the fatalities at the car accident? No, right? Like we know that because we have common sense and we have lived experiences. Our lived experiences help us understand that. With science and data, we don't always have lived experiences, right? We have to use other ways to tease out what's the causative thing and what's just associated. Because I promise you, if I went and spent the next 10 years studying how to make unbreakable glass that people could still use for their windshield and see through and all of these things in an effort to prevent fatal car accidents, well, I might succeed at making some unbreakable glass that all the car makers want to use for some reason. How many fatalities would I prevent? Probably none. Or maybe one or two if people don't get flung through the glass if they don't have their seatbelt. I don't know. I'm just making stuff up now. But like you see the point, right? The point is having unbreakable glass does not prevent fatalities at car accidents. Why? Because the glass that we see at fatal car accidents is associative, it's not causative. And so, why is this important? Because sometimes what we can see as side effects of certain medications aren't really causative in relation to the medication. What do I mean? There's one drug, and I really don't remember the name. I'm kind of glad I don't, so I don't call them out. But there's one drug that was used for elderly patients. It might have been for dementia, or it was for something that elderly people get, right? There's a drug designed for elderly people. Well, the study was done on people who are like 90 years old and above. Well, what happens to people who are 90 years old and above? Well, I mean, sometimes they just die because they're just old. That happens. That's like real life. They could be at a baseball game eating a hot dog one minute and then the next minute they're just gone. Okay, one of the side effects for this drug was death because you have to list everything that happens while a person's taking the drug. Now, did the drug cause this person to die or did they just die because they were 90? I mean, come on. So, just because we see that there's an association of side effects doesn't mean that the medication caused the side effects, right? So that's one of the things we really need to pay attention to when we're doing our risk-benefit analysis. And this is getting a little deep, so I'm going to pull out. For all the people who like to do their own research, this may be helpful for you as just things to pay attention to, right? When you see a list of side effects, you want to know that the drug caused this side effect. People are saying they have this issue when they take this medication, but is that because the medication caused it, or is that because they're just having this issue anyway? So Anyway, that's enough for today. I'm going to leave it there. This was our very first session, mostly to practice getting set up with the with the camera and everything else. You can look for us here every week, Fridays, 1 p.m. at the Community Library of Sedona. All right. Thanks so much for tuning in. Till next time. Okay, now I'm really just playing with buttons. Okay, that turns off the camera. Okay, that's a highlight thing. I don't, retouch is on for whatever that word, I don't know what that does. I guess turned off the microphone there. I don't know how to stop this. So I am going to click on the X.